Canada PR from outside Canada. This is the topic of today. One of the options is doing French. If you are able to do French B2 level and your CRS score is around 450, 460, in that case, there is high probability of getting your PR from outside Canada. But this video is not about French. In this video, I am going to share one more option, which is healthcare. Healthcare special category is one of the options where if your CRS score is around 470, 480, you can get your PR from outside Canada. I was doing this research for someone who wants to get PR from outside Canada and will be able to get the score around 470 or 480. And during my research, I found 4 jobs which can be done with any kind of background which belong to healthcare category, and with these jobs you can also get your PR from outside Canada. So in this particular video I am going to share these 4 jobs which can be done by anyone with any kind of background, and I am going to share who can do these jobs and will be able to get the PR from outside Canada. So to understand how you can get your PR from outside Canada, watch this video till the end. Hello everyone, welcome back to this YouTube channel Globexa Immigration. This is Chandra Grover. In this video, we are discussing about how you can get your PR from outside Canada irrespective of your background. With any background, you are working in banking, insurance, healthcare or any other stream, but still you can make your Canada PR possible through express entry. Yes, it is still possible for a few people who are able to get the CRS score around 470, 480. So first of all, what we are going to discuss the stream to target in express entry. The stream is healthcare special category stream. Yes, there can be one more stream which is education, but last time the cutoff was 480. So you can make your experience in education stream as well. I will make a separate video in that. But healthcare stream is far better than education stream. There are more draws in healthcare stream and the cutoff is also lower. Last time the cutoff was 470. Before that it was 475. So even after 6 months, if you are going to get 6 months of experience in healthcare, even after 6 months, you can assume that the score is not going to be really high. So even if score is going to be higher than 470, 480, 490, maybe any score, in that case, you should be open for other pathways. But till the time you are completing this experience, you should be open to try your luck with healthcare stream. So this is one stream you can target from outside Canada. And I believe that cutoff is not going to go really high in healthcare stream. So this is a stream which we want to target rather than education stream, because I feel that education stream can still stay on higher side. The cutoff can be higher, but in healthcare, because it is highly in demand, the cutoff can stay lower. So healthcare is the target stream for us. Why healthcare? The last cutoff was 470, before that 475, before that 504, 510, 463, 445. So these are the cutoffs. So if you are able to score 475, 480 CRS score in express entry, there is good chance that you can get your PR through healthcare stream. Next big question is, who can get this type of score? So this is one big question. Will everyone be able to get 475, 480 score from outside Canada? No, it is not going to be possible. But who can get it? So this is one calculation. If you are single or married, I have taken it single. You can be married as well. Then you can calculate your score again. So it's up to you to calculate. And the age is 29, not 30. If your age is going to be 30, then your 5 points are going to be decreased. So I am assuming age is less than 30. Then you are going to get full points for the age. Next is, what is your highest education? Highest education is master's or professional degree. So you can have a master degree or professional degree. You are going to get full score for that. So this is your target. You must be having a master degree or professional degree. Just like lower degree, it is a professional degree or any master degree, but you need to do WES or any other ECA for that. You need to check the equivalency of your degrees. If you are having a master degree, in that case, you are going to get full point for that. Next is your score in English. In English test, CELPIP is one of the easiest tests that you can target. Your score should be CLB 9, 9 in all modules. In IELTS, it is 8777. So you can target IELTS or CELPIP, whatever test you want to take. So you need to score CLB 9 in that. Next is your experience. Inside Canada, I am assuming it 0, but outside Canada, it is 3 years or more. And your experience will be counted even if you studied and took your experience together. So suppose you were doing a degree from 2017 to 2020, and during this degree you were working as well, working full time as well. Both these things will be counted. This degree will also be counted and this work experience will also be counted. So in last 10 years, 3 years of experience we are counting here. So total score will become 469, and last time the cutoff was 470. It can further go down in future draws maybe. So in most cases, if you have a master degree, age below 30, and you have 3 years of experience and CLB 9 in your IELTS or English test score, in that case your score is going to become 469 and you can still meet the cutoff. But scoring 469 may not be enough, and you can improve your score as well. How you can improve your score? If you score CLB 10 in your English test score, CLB 10 in all the modules, then for each module you will get 3 more points. And if you are going to add all the modules, in that case for each module you will get 3 points. This is additional 469 plus 3. But if you are going to score CLB 10 in all the modules, then it will be 469 plus 12. It is going to be 481. And with 481 score, there is high probability that you can get your invitation under healthcare stream. So you should target CLB 10 in your IELTS or English test, any test you want to take, CELPIP or IELTS, whatever test you want to take. And if you are scoring CLB 10 in your English test and you have master degree, age below 30, and you have 3 years of experience, your score will become 481. If this is your score, in that case you can relax. You can wait for your invitation under healthcare stream even from outside Canada. You don't require to be inside Canada for that. So if you just want to go on PR, this is your target. And if your profile fits into this, if your age is below 30, you have master degree, 3 years of experience, and CLB 10 or 9 in your IELTS or English test, and you already have your experience in healthcare, or you can build your experience. And how you can build your experience, I am going to share it further. Next is, what are all the eligible jobs which you can take in healthcare, which will make you eligible under healthcare special category draws. So these are the jobs. Most of the jobs are clinical jobs. If you are going to do this type of jobs, definitely you are going to be eligible. You need to get 6 months of experience and total 3 years of experience to get the right score, and 6 months of experience in any of these jobs. So this is one list. There is a big list. I'll share the link in the description where you can check for the entire list. So there are so many type of jobs. Dietitians are there and physicians are there. All kind of medical jobs are listed here. So if you are working in any of these jobs, in that case you can be eligible under healthcare special category draws, and definitely you need to get the score more than 470, then you can be eligible. Otherwise, if the cutoff is going to be lower than 470, you can be eligible with lower score as well. But in most cases, target 470 score or 480 score, then you can assume that you can sit and relax and wait for the draws in future. Otherwise, it is better that you take study visa, go to Canada, and then make your PR possible. So you can check the list quickly. I am just covering it quickly because if you are in healthcare profession, then it is all sorted for you. You can check your no code here, but the target to show is the real jobs which can be done from any background. So that is my target, not the entire healthcare. Of course, if you are working in any healthcare profession which are listed here, great. And if you are getting score 470, 480, for you it is already sorted. You can apply under healthcare stream. So you can check the list as well and find your no code. This is a no code. This is the no code. Find your job title, and if the job title is there in the list, in that case you are eligible for healthcare special category draw if you are getting the right score. But what if you don't belong to healthcare background, you are not working in healthcare, then how to build 6 months of experience? You may be having your 3 years of experience in some other thing. You may be working as a teacher, you may be working in a bank, maybe in insurance, maybe any job, maybe in IT, any job you are doing, and you are getting the score 470 or 480. You are achieving that, but you don't have the experience. How to build 6 months of experience? So my main focus is on covering the jobs without a background. If you don't belong to healthcare background, still you can get 6 months of experience, and there are 4 jobs that you can target. And the first no code is 33102, nurse aid related professions. You are not nurse, you are assistant to the nurse, and this is the job you can target. Why you need to target this job? This is entry level, very common job. Almost anyone can do it. And I am trying to get the jobs where you require either a short certificate or just a training, and then you can start getting experience. You don't require any degree in these particular scenarios. Just your 12th education, short course, or maybe training can get you this type of jobs. I am covering these 4 jobs which are not highly technical, not highly clinical, and almost anyone can do them. So where you can get these jobs? In hospitals, clinics, elderly care homes. So these are the places where you can get the job. And how to get a job, how to make the background? 12th plus any short course or in-house training will make you eligible. Just 12th education is required. So we are already considering that you need to have a master degree. So you must be having 12th as well. So without having a master degree, you will not get the score. So there is no point proceeding further. So 12th plus a short course. Any short course in India, you can get it easily, or in-house training will also work. So simply you can show 3 months of training plus 6 months of experience. 9 months, within 9 months your experience will be built. And if your CRS score is going to be 470, 480, after 9 months, you will be eligible under healthcare draws. So that's how you can build your background as well. Course, if you want to complete a course, in that case, to build your background, you can do nursing aid course, patient care course. That's how you can build your background. Or even better, just take the training. Just take 2 or 3 months of in-house training plus 6 months of experience. It will get you eligibility under healthcare special category draw. That's how you can make your experience in this. Then second knock code is 33101, laboratory assistants. Just people who take your samples. Whenever you go, they take your blood sample or any other samples. So these are the people, you can take this experience easily as well. You don't require any special type of education in this. Even if you have done 12th, still you can be eligible. Need a short course in sample collection, very easy. You go to any laboratory, ask them what kind of short course, from where we can complete it. Very short course. Just by completing the short course, you will become eligible to take this experience. Just by getting 6 months of experience, you will become eligible under healthcare special category draw. So 3 to 6 months of certificate you can take in a medical laboratory assistant. So that can be done quite easily. It can be done from any paramedical institute, quite easy to get in India. It should not be a big problem. So by taking a short certificate and 6 months of experience, and this is an entry level job in any diagnostic center or any laboratory, good to go. You can take this experience quite easily. 6 months of experience will make you eligible for healthcare special category. Third knock code is 33103, pharmacy assistant. In any pharmacy, medical store, again you can get this experience quite easily as well. And you can take this experience in any private pharmacies, medical stores, and you know that how many medical stores we are having. All the stores, means you just go in your city, there may be hundreds of medical stores in a city. So you can get this experience quite easily, and they hire assistants even without a pharmacy degree. Even without a degree, you can get this experience. To build your background before taking your experience, you can do a short certificate in pharmacy assistant. That will work for you. And you can work in medical stores, hospital pharmacy, or you can work in pharmacy chains like Apollo, etc. So that's how you can make your experience. Do a short course, get your experience, good to go. And the fourth knock code is 42201, social and community service workers. This is the best knock code. If you are watching the video till the end, the best is at the end. Why? Because this is a non-clinical role. Background is not needed. This is not a clinical role. It is not laboratory, it is not pharmacy. And you can work in NGOs, counseling centers, community health organizations. From anywhere you can get this experience. You are helping elderly people. In that case, you can show your experience. And getting this experience of social and community service worker is quite easy. You can be associated with any NGO who is helping people, helping elderly people, or people who are sick, who are not in good health. You can be connected with them. And if you are connected with them, you are getting salary. If it is a salaried job, in that case, this experience will be counted. Charity ki charity hai, and it is going to be a charity. And again, it is going to build experience for you. Just with 6 months of experience, you will be eligible under healthcare special category draws as well. And creating background is also easy. Social work, any social work you are doing like a volunteer, that will also be counted. Or you are doing any counseling assistant course, that can also work, and voluntary work, etc. So anything can build your experience quite easily. So this is one of the best knock codes to target, because you don't require any background. Just you require a right organization to give you experience. That's it. And this will make you eligible under healthcare special category draws. So if you also want to apply for your Canada PR from inside Canada or from outside Canada, we can take care of your application. It can be through French or through healthcare. And if these categories are not working for you, in that case, you need to take your study visa, go to Canada, get experience, and then you can get your Canada PR. If you want to know how you can get your Canada study visa with family, then watch this video. And if you want to know how you can plan your Canada PR, then you must watch this video. Thank you so much for watching this video till the end. See you in next video.